going to be presenting about informal social accountability, mechanisms in WASH in childcare centers in Nairobi's informal settlements. And this is part of the ARISE consortium work, and I work at the African Population and Health Research Center. Children in childcare centers lack quality WASH, yet WASH is central to child health, and you can already see how the WASH, the sanitation facilities are so poor, and the same children would use and wash, including those with disability, and wash their hands using water from the drainage and drink the same water. And this leads us to try to figure out about the social accountability triangle that has parents, childcare providers, and policymakers, whereby in most cases, the full triangle is usually a formal accountability system, while parents and childcare providers in most cases operate informally. And since the provision relies on informal social accountability mechanisms, and the mechanisms are usually unrecognized and undervalued, for this work, we really want to explore the informal social accountability mechanisms that are being used in childcare centers, so that it could be a lesson, it could be a best practice for other childcare providers who would who are usually mushrooming. And just as the study was done into informal settlements in Nairobi, and before the data collection, we had a community outreach and also the school outreach. And it was qualitative in nature, using ethnography, particularly governance diaries. And governance diaries is a basket of methods that included observation of WASH facilities, reflection of the occurrences, participant diaries, informal discussions, and in-depth, and all these 4 approaches informed the in-depth interviews that were done bi-weekly for a period of 4 months. And this were the distribution of our study participants, and we used a framework analysis. There were 4 major themes, but I'm only going to focus on informal social accountability mechanisms. And from our findings, we found that there were discretionary actions that included rewards, sanctions, and peer mentorship. There were also some informal accountability mechanisms that included respecting the demands for WASH services, valuing or prioritizing WASH needs, even at the expense of needs of the parent, and trust between the actors, to the extent that they would even allow for credit to the parents, that I would bring my child without bringing water, but then negotiate to bring water later or when you get the money. There were also facilitative behaviors that included a sustained communication on a weekly basis, or when you're picking your child from the school, reporting on complaints on poor WASH services, on lack or delayed payment of WASH services, and reliability in service provision and credibility. We discussed our findings by the fact that parents using principal stewards theory, where the principal were the parents and the stewards were the center managers. And according to stewardship theory, a principal stewardship theory, the principal and the stewards would work together to achieve a common goal. And for our case, the common goal was WASH provision. And in the attempt for the principal and steward to operate, they came up with some initiatives or mechanisms that would help them to ensure that their goal could be achieved. And they developed discretionary actions, norms, and values and facilitative behaviors that enable them to avail WASH at the childcare centers. And because we could not proceed with all the 10 uh, mechanisms that were identified, we did pocket voting. Pocket voting is whereby the community members or the participants of interest, for our case, parents and childcare providers, would vote for the best mechanism based on how it has been operating in their context. And it is from that we were able to identify rewards for WASH service provision to be a mechanism that was widely applicable, and respect demands for WASH needs of children as also a key mechanism, and also sustained communication. So we wanted to go forward and understand deeper about these mechanisms that were widely applicable and described as practical. And we did reflexive workshops, which is an more of interpretive and collaboration, and it acts as a dialogue and validity testing, because we get to describe each, how it operates, and so forth of the three mechanisms. And we went ahead to do a co-learning whereby the actors who had applied the three mechanisms longer than the rest would take through the others on how it operates, the advantages, the shortcomings, and so forth. In conclusion, it is valuable to explore social accountability mechanisms, and it's important to note that informal social accountability mechanisms exist regardless of the presence or strength of a formal social accountability mechanisms in a sector. Even like in a water point, or even when you're going to buy something, sometimes there are informal social accountability mechanisms that would help you get to understand um, the operations, rather than waiting for the formal process that would take longer. And it's important to note that informal social accountability mechanisms are not limited to managerial and administrative ranks in the sector. This is because even the parents, or even the childcare provider who are not at the management in any way, are able to operate using the mechanisms. And we recommend stakeholders to explore and build on existing social accountability mechanisms. And the fact that sometimes it's important to go beyond tangible resources. And I acknowledge the GCRF, UKRI, who are funding this project, the African Population and Research Center where I work, the ARISE consortium that this work is part of, study team, the community, the participants, the research assistants, my supervisors, Professor Penny Howard, Professor Helen Elsie, and Professor Blessing Mbero. And thank you so much. If you have any question, please share using my email address, ivchumo@gmail.com. And I am actually very sorry that I did not manage to attend this meeting. Otherwise, thank you, and have a good evening. Thanks.